Nearly every patient that comes into the hospital comes in with pain. Our goal is to try to manage that pain, and then we expect them to treat us favorably on a satisfaction survey. That requires effective pain management. The HCAHPS survey asks two questions with regards to pain management. How often was your pain well controlled? And how often did hospital staff do everything they could to help you with your pain? And remember, these answers are on a scale from never to always. So as always, consistency is the key. So what does it mean to effectively control pain? Well, it might not be what you think. We might imagine that to effectively control pain, we need to completely eliminate a patient's pain, but that's not true. In fact, there are certain levels of pain that are necessary for diagnosis. But even more important than that, studies have shown that patients do not need to have their pain completely eliminated to have good pain management. To have good pain management, they need to feel like they have a partner, someone that's working with them on their pain management plan and listening to how it's going. This starts with our attitudes about how we see our patients when they talk about pain. It's all too easy as caregivers who have seen hundreds, if not thousands of patients talking about pain to start lumping patients into certain categories of drug seekers or where we see their pain needs as something negative. We have to really give each patient a fresh start to let them start over so that we can adequately listen to what they're saying. The main tactic for pain management is patient education, and that starts with being honest. Let their patients know that we're not going to completely eliminate their pain, but work with them in making a goal for a reasonable pain goal. A pain goal that's attainable and one that can help them to function. A pain goal might be a certain level on the visual analog scale to get from an 8 out of a 10 to a 3 out of a 10. It might be a functional goal that they can walk in the hall without pain, or walk in the hall a certain distance, or even sleep through the night without pain. The idea is to find a goal that works for them that's attainable. When you set these goals, use the administration time of medications to really set expectations. When you deliver that medication, of course, you're going to use the name, dosage, purpose, and side effects. But more than that, you're going to set an expectation. I'd expect that in 45 minutes you should be feeling better and your pain level should be decreasing, and I'll come back to check on you. You've set that expectation of not only trying to achieve their pain goal, but when you'll come back in to make sure it's met. And if it's not, you'll work with them, contact the physician, or whatever else needs to be done. The idea is they know that you're not a magician who's going to make their pain disappear. You are partnering with them to get the best pain management possible. The last tactic we'll talk about addresses the question asking, did this hospital staff do everything they could to help manage your pain? That's a big question. Did we do everything we could? And how do you quantify that? It's another one of those vague questions that can be a little frustrating for caregivers. The idea here is not necessarily to do one particular thing, but it's to do everything we can. That's the idea for some patients of maybe something that's non-pharmacological, an alternative pain control method. That could be anything from hand-holding to acupuncture to changing a position to aromatherapy or music therapy. Your particular facility may have different things available to them, but it's the idea that we're going to try to do something rather than just giving them a pill to take. If they feel that we're at least trying something, they're going to feel like we've done everything we can. The main takeaway, the main tactic to employ with pain management is to just simply be honest. Tell your patients that you can't completely eliminate their pain and work with them, partner with them in setting a patient goal for their pain that's attainable. In our next and final video of this series, we'll be talking about our patients discharging to home or to their next level of care and the importance of not waiting to the end of their stay to start that process.